this National Health Dialogue. We're gathered here to discuss a very important topic, I would say. Evidence, innovation, and financing for a healthier Nigeria. We will all agree that healthcare is very critical, and if we don't get healthcare right, we don't get a nation right. And so, we're very happy to have you distinguished guests in the room, and we also have a lineup of panel sessions, health innovation showcase, and a commitment session from critical stakeholders in the healthcare sector. And we hope that you stay through with us for this very important conversation today. So without much ado, I would like to welcome the CEO of the Center for Journalism, Innovation and Development and publisher of Premium Times, Mr. Dapo Olorunyomi OON, for his opening address.
Your Excellency, a very distinguished guest, I must start with profound apologies. Sometimes Abuja is a very difficult city to coordinate things, so we would have wanted to start earlier. We have words that our other distinguished guests are on their way, so you'll please bear with us in this regard. Okay. So good morning, distinguished guests, colleagues, and friends. Thank you for being here today on what we believe is one of the most important conversations we have as a nation. We have titled this dialogue, Evidence, Innovation, and Financing for a Healthier Nigeria. These three words, evidence, innovation, financing, represent the three pillars on which any functional health system must stand. And if we are honest with ourselves, Nigeria's health system is struggling because we have been weak on all these three fronts. Your Excellency, distinguished guests, I have spent most of my own adult life working in journalism and building institutions that defend democracy and promote good governance. And I can tell you for sure that a nation's health system is one of the clearest indicators of whether its democracy is working. When mothers die in childbirth from preventable causes, that's a governance failure. When children miss life-saving immunization because health centers have no vaccines, that's a governance failure. When families are pushed into poverty because they must pay out of pocket for basic health care, that's obviously a governance failure. Democracy is about elections and institutions, but it's also about whether the government works for ordinary people. And nowhere is this more visible than in the healthcare system. For too long, we have accepted a situation where rhetoric substitutes for action. We signed the Abuja Declaration committing 15% of our budgets to health, but most states allocate less than 5%. We launched the health initiatives with fanfare, but implementations often falters. We approve budgets, but funds are released late or not at all. We build primary health care facilities, then painfully abandon them. This is not a resource problem. Nigeria has resources. This is a prioritization problem. It is also a governance challenge. It's ultimately about what we must prioritize and value as a community. Let me speak directly to why we're here today. At Premium Times and CJID, we have invested in investigative health journalism because we believe that information is power. When citizens know how health budgets are spent or misspent, they can demand better. When journalists expose substandard products in our markets or regulatory failures that endanger lives, they create pressures for reform. When we track health outcomes with data, we measure progress and hold systems accountable. The documentary we will watch today, Health Under the Microscope, shows some of this investigative work. It is uncomfortable viewing, but discomfort is sometimes a necessity that can lead to fixes. And I want to say that investigative journalism has led to some real and substantive changes. For instance, after a Premium Times report on healthcare failures in Akwa Ibom State, the government declared a state of emergency on healthcare. That's evidence leading to action. That is also accountability working as it should. The journalism alone cannot fix healthcare systems. We also need innovation, we need financing, and we need, above all, political will. On innovation, one thing that gives hope is the explosion of homegrown health innovation happening across Nigeria. Young Nigerians are building digital health platforms, improving maternal care through technology, strengthening diagnostic capacity, and reimaging how health services are delivered. These innovators are not waiting for perfect conditions, they are building solutions now, often with minimal support. The question for us, for government, for development partners, for investors, obviously for the media, is whether we will recognize this innovation and invest in it at scale. Nigeria does not need to import all its solutions. Many of them are already here, waiting to be supported. And now the hardest issue, money. Money alone does not fix systems. We know that. But without adequate, sustained, and well-managed financing, nothing else will work. We cannot run health facilities without funds. And we cannot pay health workers without budgets. We cannot procure medicines without money. The Federal Ministry of Health's recent red card to state government was not an act of micromanagement in our view. It was a recognition that business as usual is failing Nigerians. It was a call for urgent action on oversight, efficiency, and accountability in health spending. And that call was necessary. Because the truth is that we are not just underfunding health, we are also mismanaging what little we allocate. Budgets approved but not released, funds released, not effectively accounted for, equipment procured but not maintained, facilities built but not staffed. We hope this is something that can change. Later today, state commissioners and representatives will make public commitments for 2026. I want to say directly that we will hold our commissioners to these commitments, not out of any act of malice, but out of belief that what is possible when leaders choose to act with courage and integrity. Civil society will track budgets, journalists will monitor implementation, citizens will demand accountability. That is the meaning of a functioning democracy. Let me say this in closing. Distinguished ladies and gentlemen, the global health financing landscape is changing. Donors are withdrawing. Nigeria can no longer rely on external funding to fill gaps in our health system. This is actually an opportunity to build a health system that's truly ours, that is sustainable, that is accountable to Nigerians and not necessarily to donors, that prioritizes what we need, that prioritizes what we need, not what external partners always think. But seizing this opportunity requires honest conversation, difficult decisions, and sustained commitment. That is what today is all about. We have gathered, therefore, the right people in the room: ministers, commissioners, journalists, health workers, innovators and advocates, development partners, and citizens. We have the evidence, we have the innovations. What we need now is the financing and the political will to make it all work. Nigeria's health crisis is solvable, that's our view, and not oversight, not without difficulty, but solvable. The question is not whether we can do better, the question is whether we will. Thank you so very much for being here. Thank you for your commitment. And let us leave this room today with clear commitment that we will track, monitor, and fulfill. Thank you very much, and very good morning.
Well, please put your hands together one more time for that opening remarks. Thank you very much, Mr. Dapo Olorunyomi, for that powerful opening remarks. And we are grateful to CJID and Premium Times for its commitment to quality reporting in the healthcare sector. Now, before we move ahead, I would like to crave your indulgence once again to please move forward. We have a lot of empty seats. Thank you, thank you, thank you. As we do that, permit me to recognize the presence of Her Excellency, the Deputy Governor of Kaduna State, who is in the house, Dr. Hadiza Sabuwa Balarabi. Can we put our hands together? Deputy Governor, thank you for coming. Permit me to also acknowledge the presence of the Honorable Commissioner of Health of Kaduna State, Hajia Umar K. Ahmad. I'd also like to acknowledge the presence of the Private Secretary to the Governor of Kaduna State, Hajia Hasfat Aminu. All right. Without much ado, we will take some very special remarks from our partners in the House. And with a round of applause, can you join me as I welcome the Senior Communications Officer at Gates Foundation, Fatima Abubakar Al-Khali.
Distinguished guests, colleagues, partners, members of the media, and friends, permit me to stand on existing protocol. Good morning, everyone. It is an honor to be here at the National Health Dialogue 2025, a forum that has consistently pushed the boundaries of what honest, evidence-driven conversation can achieve in Nigeria's health sector. Before I continue, I'd like to give a small caveat. As Mr. Dapo was speaking, I thought to sound like an echo because my words are a summary of what he just spoke about this morning. So that's the caveat. Let me begin by appreciating the Center for Journalism, Innovation and Development, CJID, and Premium Times for convening this gathering. Your leadership ensures that national dialogue on health is grounded in facts, elevated by strong journalism, and driven by a commitment to accountability and solutions. This year's theme, Evidence, Innovation, and Financing for a Healthier Nigeria, captures exactly what the moment demands of all of us. Because today, Nigeria stands at a crossroads. We know the challenges: maternal mortality remains unacceptably high, too many newborns still die from preventable causes, primary health care is uneven, and financing for essential health services is often unpredictable. But we also know something else. The solutions are within reach. This is where the three pillars of today's theme become very powerful. I'll just touch a little on evidence. So evidence tells us where the system is working and where improvement is needed. It shows us the communities most left behind. It also reveals the cost of inaction and the opportunities for impact. From data on routine immunization to maternal survival trends, evidence is the compass that must guide our decisions. And the role of the media in translating this evidence for the public cannot be overstated. When journalists tell data-driven stories, policy shifts, priorities change, and resources move. On innovation, Nigeria is already demonstrating how innovation can save lives. Digital tools that improve primary healthcare quality, data quality, new platforms that bring evidence and services closer to families, maternal health innovations that help keep mothers alive while giving birth. Innovation is not just about technology. It is about new thinking, new partnerships, new models of community engagement, and new approaches to strengthen systems from ground up. Financing. Even the strongest evidence and the most transformative innovations require one thing: sustained, predictable financing. Nigeria has begun taking important steps from state-level commitments to immunization financing, to efforts to strengthen budget execution, to new collaborations that unlock resources for primary health care, but so much more is needed. It will take government leadership, development partner alignment, private sector engagement, and an active media holding all of us accountable for the promises that we make. The Gates Foundation remains committed to partnering with Nigeria on this journey to strengthen maternal and newborn health, expand routine immunization, scale proven innovations, and support systems that ensure efficient and equitable use of resources. But ultimately, the work ahead is a collective responsibility. Evidence must shape decision-making. Innovation must accelerate progress. Financing must match ambition. And accountability must guide us every step of the way. That is why today's dialogue matters. Because when we bring journalists, policymakers, health leaders, civil society, and development partners together around one table, we build the momentum needed for a healthier Nigeria. On behalf of the Gates Foundation, I thank CGID, Premium Times, and all of the partners for sustaining this important national platform. We look forward to deeper collaboration as we work in services of a Nigeria where every mother survives childbirth, every child thrives, and every family can access the care that they deserve. Thank you.
Thank you very much, Fatima, for that goodwill message. Before we go right ahead, permit me to also acknowledge the presence of Dr. Temitope Ilori, Director General, National Agency for the Control of AIDS. Thank you very much for coming. Permit me to also acknowledge the presence of Dr. Muyi Aina, Executive Director, National Primary Healthcare Development Initiatives. Please, as I call out, can you put your hands together? Permit me to also acknowledge the presence of the Honorable Commissioner for Health, Katsina State, Honorable Musa Adamu Funtua. The Honorable Commissioner for Health, Gombe State, Dr. Habu Dahiru. We also have the Permanent Secretary, Abia State Ministry of Health, Dr. Ifeinwa Blossom. Thank you. We also have the Honorable Commissioner for Health, Jigawa State, Dr. Muhammad Abdullahi Kainua. And we have in the House the Chairman, House of Assembly Committee on Health, Akwa Ibom State, Honorable Moses Essien. Our distinguished guests, thank you very much for joining us, and we will take our second goodwill message now from Dr. Temitope Ilori, Director General, National Agency for the Control of AIDS. Thank you very much.
Good morning, everyone, distinguished ladies and gentlemen, Your Excellency, the Deputy Governor of Kaduna State. Good morning, ma'am. the ED CEO, National Primary Healthcare Development Agency, my brother, my friend, my sister, the Honorable Commissioner for Health. But before I go to her, I think the SSG, Kaduna State, is in the audience. Good morning. The Honorable Commissioners, my sister from Kaduna State, my brother from Katsina, from Jigawa, and all the others. Good morning, and you are welcome to Abuja. I think I have the right to say that. And Timoji and others, of course, the organizers of today's event, CJID and Premium Times. Thank you so much for this invitation and for putting this together. I think it's good when we judge as Nigerians and we don't wait for others to invade our sovereignty. You know, it's good for us to realize where the gaps are and to discuss around it. So I think today's National Health Dialogue around evidence, innovation, and financing for a healthier nation is quite apt at this time because of all the global politics that is going on and, of course, the changing funding landscape in the health sector generally. So I'm happy that the journalists have deemed it fit to put together this program to discuss around this. And I must say that Premium Times is an outfit that I hold in very high esteem. I have two major mainstream papers that I hold in that esteem. And when I see some information online, I wait, I go to their page. If I don't see it on Premium Times, then I don't carry it. I know it's not true until I see it on that and then one other, which I will not mention. Then I know, okay, this is authentic. So I give it up to you for your investigative journalism. And I also appreciate the Center for Journalism, Innovation and Development. Thank you for deepening the conversations around Nigerian health sector. Like I said, the intersection of journalism, public health, and national development cannot be overstated. Quality health journalism informs policy, shapes public opinion, holds institutions accountable, and ultimately save lives. You know, sometimes you just sit in your bedroom, and I don't know, people are just funny, especially in this jet age of artificial intelligence and all whatnot, different apps, and they just come up with a story. I don't even know how they do it, because sometimes it will be like a whole page long of lies, misinformations, no wrong information, and they just say, oh, people are dying in Kaduna State, oh, HIV is killing everybody, oh, in fact, 200 people have died overnight, and you are like, ah. And you start calling around and finding, and the most disheartening is that you now see mainstream traditional media carrying this information, and when you investigate, they will tell you they saw it on somebody's Facebook, it was a post that was posted online, without doing any investigation at all. I'm using this, I'm posing this as a challenge to journalists in the auditorium. Please, you are watchdogs. We owe you in so much esteem. You're supposed to inform the public. You're supposed to educate the public. So you should do away with misinformation, with things that you cannot verify. And we are always out there to help you to verify. And also, as a government, I stand there, of course, proudly as a representative of this government. Even as a government, there's so much we're doing. When I go outside the country, South Africa, US, you know, people tell us, Nigerians, I don't understand you guys. Oh. You are so eminent. You are there in the health sector. You are there in the industries. You are there in the academia. You are the one moving other nations. And then you just keep demarketing yourselves and giving yourself different public images and all that. And they always laugh at us because they know we are great. And we are indeed a great nation. So it's a poser to Nigerians, particularly the journalists, because people hold you guys in high esteem. Please kindly use your platform to promote. Let's dwell more on what unites us than on what's the right word now? Divide us. Thank you so much for that. It's not every time that you get to talk to journalists, so I think I should just use that. So like I said, as we continue to confront the evolving public health challenges, from infectious disease to the burden of non-communicable disease, collaboration becomes very critical. At NACA, we remain dedicated to sustaining the national HIV response. Interestingly, this is our week. We're celebrating the World AIDS Day week. You can see me all colorful and all red. I'll be leaving here very soon to go and join the youth. We have a whole day with the youth, educating them, about what HIV is and what it isn't. And therefore, I believe that we need this renewed focus on prevention, on treatment, and on health system strengthening. Health is so intertwined. Yes, I'm HIV, but you can't do HIV without a very strong primary health care system. You can't do HIV without a very strong general hospital. You can't do HIV without a strong research, without strong healthcare delivery, without strong health systems. And I stand bold to say that the government of the day is addressing this in leaps and bounds. I'm sure Dr. Omoyi will tell us how many PHCs has been renovated in the last couple of years. I know the National Health Insurance Agency is onboarding, vulnerable groups, pregnant women, under 5 children, and even people living with HIV, tuberculosis, and other non-communicable diseases. And this scheme is expanding and is being more inclusive, of the vulnerable group to ensure that nobody is left behind, that health is accessible, is affordable, and is available for as many people that needs it. Well, I have to say all this because we are talking about financing for a healthier nation. So I must educate you and inform you about some of the steps the government of the day is doing to overcome the challenges of financing health system. On that note, I believe that this year's dialogue will provide us a very timely opportunity to reflect on the progress made, to address persistent bottlenecks, and to chart forward pathways towards a more sustainable, a more patient-friendly, and people-centered health sector. I'm confident that the insights generated from today's discussion will contribute meaningfully to the ongoing reforms across the country. On behalf of the National Agency for the Control of AIDS, on behalf of the Federal Government of Nigeria, I congratulate all organizers, all participants in this room, and I wish us a very useful deliberation. Thank you, and God bless you.
Let's make that round of applause louder. Thank you very much, Dr. Temitope, for that goodwill message. Before we take the next, permit me to recognize the presence of Dr. Charles Olusegun Doherty, General Manager, Ekiti State Health Insurance Scheme. Can we put our hands together for Dr. Charles? Thank you for joining us. May I also acknowledge the presence of Professor Umaru Pate, Board Chair, Center for Journalism, Innovation and Development. Come on, I need you to make your applause louder. Permit me to also acknowledge the presence of Vivian Ihekwazu, Managing Director, Nigeria Health Watch. May I also acknowledge the presence of Mr. Idris Akinbajo, Managing Editor, Premium Times. Please put those hands together for Mr. Joseph Adeyeye, Managing Editor, Punch Newspaper. All right. Now we will go right ahead to the next goodwill message. And to give us that, please welcome Mr. Idris Akinbajo, Managing Editor, Premium Times.
Good morning, everyone. All protocols duly observed. Yesterday, our President Bola Tinubu, declared a national emergency on security to address Nigeria's security challenges. In the declaration, the President outlined 6 key steps his government plans to take or initiate. Some of these steps are bold and require fundamental changes to Nigeria's laws. While we commend the President for those initiatives and hope he follows through on them, we all know that you cannot truly achieve security without addressing the issue of human development. And when we talk about human development, we are primarily talking about education and healthcare, the latter of which brings us here today. A representative of the Gates Foundation spoke not too long ago, and each time Bill Gates comes to Nigeria, he reminds the Nigerian government of the need to pay more attention to human development. I'm Yoruba, and the Yoruba have a popular adage that says, if you refuse to train a child and instead use the funds to build a house, the child you refuse to train will end up selling the house you have built. That is what we are witnessing across Nigeria. Our young people are disillusioned and angry because we have refused to train them, to provide adequate health care for them, to provide adequate education, and to provide human development for them. That is why they are hungry and curse on social media. That is why they japa. That is why they go into all forms of criminality, from cybercrime to terrorism. Premium Times is happy to co-host this symposium to have policymakers, experts, journalists, and others discuss on how we can improve Nigeria's health indices, which could contribute to making life better for Nigerians, young and old. As we all know, the issue of healthcare is not just the responsibility of the federal government, but our findings at Premium Times from various states show that our state governments are not prioritizing healthcare as they should. We do not pretend that states have unlimited funds, but facts show that the states are focusing on the wrong things. I'll give just 2 examples. According to the latest Nigeria Demographic and Health Survey 2024, Jigawa State has the highest under 5 mortality rate in Nigeria at 161 deaths per 1,000 live births. The neonatal mortality rate in the state increased from 46.8 deaths per 1,000 live births in 2018 to 52 deaths per 1,000 live births in 2024. Our investigations at Premium Times show that despite the reconstruction of some PHCs, Jigawa still has scores of poorly equipped and staffed PHCs which contribute to these deaths. Yet, the state government spent 3.2 billion naira on renovating government houses and purchasing luxury SUVs last year, more than the 2.8 billion naira it released for all PHCs through the Jigawa State Primary Healthcare Development Agency. Also, take oil-rich Akwa Ibom State. The PHCs in the state suffer from an acute shortage of personnel. Our investigations at Premium Times show that on average, a PHC has fewer than 5 workers, a far cry from the 24 recommended by the NPHCDA as a minimum. The lack of personnel leads to death of pregnant women and children in the state. In fact, the aforementioned NDHS 2024 survey shows that Akwa Ibom has one of the lowest percentages of live births delivered in a health facility in Nigeria. It ranks lowest among the 17 southern states of Nigeria. The report further shows that Akwa Ibom has one of the lowest percentages of births delivered by a skilled provider in Nigeria, the lowest across all the southern states. In June, the Akwa Ibom State Head of Civil Service, Efong announced that the state government would employ 1,000 medical personnel, a grossly insufficient number to address the crisis. Our findings show that to staff all the 468 PHCs in Akwa Ibom State with 24 workers each, as recommended by the NPHCDA, means that 11,232 staff members are required in addition to the supporting staff. Official figures show that, as of now, Akwa Ibom currently has about 2,164 PHC workers, which, if you add the 1,000 new recruits, adds to 3,164. This leaves a shortfall of 8,068 workers to standardize Akwa Ibom PHCs and prevent these needless deaths. You may then wonder, where does Premium Times want Akwa Ibom to get the funds to hire 8,068 workers from? We crunched the numbers. Akwa Ibom's 2024 full-year budget performance report shows that the State Primary Healthcare Development Agency spent 37.1 million naira as personnel costs on its 2,164 staff members in its health facilities in the agency. So if it employs all new 8,068 staff, its personnel costs for them would increase to about 226 million naira. Where would the money come from? According to official figures, Akwa Ibom spent 1.3 billion naira to buy luxury SUVs for the state's 13 federal lawmakers in the National Assembly. If instead of spending 1.3 billion naira to buy SUVs for over-pampered federal lawmakers, it had put the 1.3 billion naira in PHCs, Akwa Ibom would have been able to hire all the personnel needed for all its PHCs and pay their full salaries for 3 years, thus preventing thousands of maternal and infant deaths. These findings are not peculiar to Akwa Ibom or Jigawa. We found similar things in other states like Bauchi, Adamawa, and Bayelsa. So, why are we co-hosting this conference? We hope that we can discuss why states are not prioritizing healthcare, why they appear to prioritize frivolities over the health of their residents, and perhaps help us see what we are missing. Then together, we can all suggest how to make progress. Thank you.
if I would think that Mr. Idris bribed this audience because that round of applause was very loud. Thank you very much for that goodwill message. Before I go ahead to call the next goodwill, permits me to recognize the presence of Dr. Ibrahim Wada, the Chief Executive Officer, Nisa Premier Hotel. Can we put our hands together? Hospital. My apologies. All right. Hospital, definitely, not a hotel. Put your hands together for me. All right. So our next goodwill message, we will take that from Mrs. Vivian Ihekwazu, the Managing Director of Nigeria Health Watch. Nigeria Health Watch has been a very strong partner to CJID and Premium Times, and we're very glad to have you here, ma'am. Over to you.
Thank you very much. I almost feel coming up here after Idris, I think, thankfully, set the tone in his very candid goodwill message. I think it's very important that we have Premium Times and other such publications really crunching those numbers and presenting the facts. But that's why we're here as journalists. We're part of the society. We're an important part of holding government accountable. When I say accountable, I mean accountable in terms of partnership. So really pleasure for us to be here as an organization. As I mentioned, my name is Vivian Ihekwazu. I'm the Managing Director of Nigeria Health Watch, standing on all existing protocols. It's such a pleasure to be here, I think, this morning for us, to be part of this very important dialogue that Premium Times and CJID have convened. And also, very important, thankfully, also to the Gates Foundation, whose commitment to strengthen the space of storytelling and ensure that we are all, as a country, pushing for better health outcomes is extremely important. But also, what's really, I think, important and really exciting about today is, I think, the mix of people in this room as well. As much as we are convening this on the basis of as journalists, but also looking across the room, have policymakers, civil society, private sector, reminding all of us that to transform Nigeria's health sector really is a collective effort and is a responsibility for all of us. And as we stand here as journalists, as an organization, we all are striving for the same thing. Change only happens when we use data, when we use evidence as presented by what Idris said at the very beginning. And it's really important, as Dr. Temitope Lori mentioned, that when we as journalists, when we report on the news, when we report the facts, that we are sure that we use evidence and data. When I say data, actually evidence-based information, not information that's quoted from sources that cannot be traced. But we ourselves are responsible for making sure that we report accurately for the simple reason that we have such a large audience and we have such a large reach. And Nigerians really are counting on the media to report on the news. All of us witnessed the proliferation of digital channels. So tomorrow you have a new publication come, and everybody has access to the internet. So information is out there for everybody. So that's why it's important to have evidence-based and trusted information sources where people go to. And I have to actually agree with you. Premium Times for me also is a publication that I also go to when we report on information, just to check that when we are reporting that we actually have that correct balance, informing our different audiences and making sure that we hold ourselves accountable to the very high standards. So this year's theme, focusing on journalism that shapes public debate, innovation, improving access and affordability, is a really important one because we all see how the changing global landscape of financing has affected all of us, not just in Nigeria, but regionally. And that is why we are here really, to how do we ensure that going forward, that the intersection between health and journalism, we use facts and strong reporting to make sure that we push for action and we hold our governments accountable, as I said before. We know that a strong health system depends on strong information ecosystem, one where journalists are able to ask tough questions. And when I say ask tough questions, it means really asking our government officials those questions we really want answered without fear or without favor. These questions are simply being asked because Nigerians also want to know that information. And as public officials, we feel they also have a duty to to report and also make themselves available to answer those questions. Because citizens do have a right to have the right information and expect accountability for those that serve them, for those that serve us. So this National Health Dialogue is a really important one, because I think this is a good place to bring all these conversations together. You know, we talk about health at the national level, but we also need to make sure that we look at the regional, look in the communities, in the primary healthcare systems, at local government areas, in households. This is where decisions every day are made. That's why, you know, we remain as an organization, Nigeria Health Watch, also committed to shine a spotlight on what's happening at the subnational level. So we have our Community Health Watch project, where we train journalists in communities to use their own platforms, to use their own voices, to report on healthcare delivery at the community level. You know, we can all be here in Abuja in our air-conditioned offices and meeting rooms talking about healthcare, but the reality is, in the rural areas, in the communities, this is really where sometimes the rubber hits the road. And people in communities do not often have a platform and access to report on how they, on a daily basis, are experiencing healthcare. So we may put out the numbers, say X amount of money has been sent to this primary care facility. But when you now speak to people who are accessing care in that facility, sometimes the story is different. And it's important to also hear those stories, because the people who we often hear reporting those stories are mothers. You know, when we hear of a mother who is in Niger State, she's going to give birth in a community, in a facility, and her relatives have to bring water for her to give birth. We know that is not right, because we all know that if that was us, how would that be? So it's important that we also shine a spotlight and provide a platform for also people at the community level to be able to report on how they access healthcare. Together with other Gates partners, we're carrying out our Know Your PHC campaign. And the aim of this campaign is really to bring attention to primary healthcare system, which we all know is the backbone of a strong healthcare system. And fixing primary healthcare is not just about, you know, fixing buildings, but it's really also about the people, the quality of care that people receive in those communities. So really this Know Your PHC campaign and the Community Health Watch Project, working with other partners, is today really looking to provide some of that other evidence that we need to see and we need to share to be able to improve healthcare delivery. Because we know that the ultimate journey that we're all striving for is universal health coverage. Pretty simply said, how do we make sure that people access healthcare without being financially disadvantaged? They receive quality healthcare as and when they need it. So having these other platforms to be able to raise these important discussions, we feel is important. And especially working with partners and also the media. How do we report on some of these stories so that ordinary Nigerians also learn that to prioritize healthcare is in our collective interest? Sometimes we look at see how much healthcare is prioritized in Nigeria, and we realize it's suboptimal. You know, in some countries we can often see that health policies is what can drive a government. And how do we make sure that Nigerians prioritize healthcare? Because if we have a sick nation or people don't have access to affordable healthcare, we all know what that does to economic productivity. So I think it's in all our collective interest to make sure that Nigerians also understand that they have a right to have access to quality healthcare, and they can able to afford it without being financially disadvantaged. And that's where, of course, health insurance comes to. So I think today, as we listen to the stories, we thank Premium Times for convening this event. I think it's important that we look to build a healthcare system that we can all be proud of as a nation. We know we have one of the poorest health indices, and we need to know that we need to push to really improve them. Of all the other countries across the African continent, Nigeria often scores poor in terms of maternal health outcomes, child outcomes, immunization, but we know that there have been improvements, and we're really pleased with the current government for pushing some of the initiatives that have delivered on this. So as we continue and work together across all levels of government and with communities, we know that on behalf of Nigeria Health Watch and Premium Times and all the other organizations convening this event, we hope that today's discussions really shed some light on some of those questions that sometimes we want to know, sometimes we as media want to ask. And it's really great to see the number of commissioners who are in this room today. Because as I mentioned, a lot of the healthcare that we're talking about really is at the subnational, not just at the national. So thank you so much, Premium Times, for inviting Nigeria Health to be part of this important dialogue. And I look forward to hearing a lot of the discussions that will go on today. Thank you very much.
Thank you very much for that goodwill message. Before we take the next, please permit me to once again recognize the presence of Professor Bello Jamor, Executive Secretary, Kaduna State Primary Health Board. Can we put our hands together for Professor Bello? Thank you very much for joining us. And now, we take one more goodwill message, and with a round of applause, can we welcome Tessie Igomu, Deputy Editor, Punch Weekend Titles, representing Mr. Joseph Adeyeye, Managing Director and Editor-in-Chief, Punch Nigeria Limited. Can we put our hands together?
Thank you very much. Good morning, ladies and gentlemen. Permit me to stand on existing protocols. My name is Tessie Igomu. I'm here to represent the Managing Director and Editor-in-Chief, Punch Nigeria Limited, Mr. Joseph Adeyeye. So this is a good message at the National Health Dialogue 2024-5 in Abuja. Distinguished guests, respected colleagues, partners in development, ladies and gentlemen, I'm here to stand on behalf of Mr. Joseph Adeyeye, like I said earlier, who is unavoidably absent, and he actually wished to be here. It is indeed my honor to bring to you warm greetings from Punch Nigeria Limited as we gather for the National Health Dialogue 2025, hosted by the Center for Journalism, Innovation and Development and Premium Times. We are delighted to be part of this important national conversation on health, one that continues to shape Nigeria's development trajectory and define the well-being of millions. At Punch Nigeria Limited, our mission has always been clear and unwavering. Since our establishment, we have remained committed to informing, educating, and empowering Nigerians with credible journalism. Our mission is rooted in public interest and has evolved into deeper responsibility to provide reliable fact-based reporting that holds power accountable, amplifies community voices, promotes solutions in a nation where health challenges continue to test our resilience. In line with this commitment, after decades of consistent and established in line with this commitment and after decades of consistent and transformational health reportage, we established Punch Healthwise in January 2020. Although Healthwise has existed before then in our print edition and is indeed one of our newspaper's most popular sections, by the way, I am also here with my colleague and the editor of Punch Healthwise, Angela Onwuzo. Thank you. Our reason for moving Healthwise online was simple but ambitious: to deepen health reportage, improve public awareness on issues linked to the Sustainable Development Goals, particularly SDGs 1 and 6, and to extend the benefits of in-depth health reportage to our growing population of online readers. Our attendance at this event can be linked to that objectives. Punchwise's broader objectives are very much in sync with the objective of this summit. At a time when Nigeria continues to grapple with limited access to quality health care, there's underfunded health institutions, brain drain, insecurity-induced health disruptions, and widening inequalities. A platform like the National Health Dialogue is essential for policymakers, journalists, researchers, civil society actors, professionals, and the public to reflect on debates, innovate, and chart actionable steps toward a healthier nation. So we salute CJID, and like I told Sada Kolonromi, well done for all you do. Thank you for all you do. We salute CJID and Premium Times, and for providing this critical space for engagement and accountability. We reaffirm Punch's dedication to Nigeria's health sector. telling the stories that matter, spotlighting systemic failures, humanizing statistics, and pushing for reforms that will ensure no Nigeria is left behind. On behalf of fruitful discussions and impactful outcomes, may this year's dialogue spark ideas, strengthen collaborations, and inspire real solutions that will move Nigeria closer to equitable and resilient health system that we all envision. Thank you, and God bless you.
Can we make that louder? All right. Thank you very much. That brings us to the end of our goodwill messages, and we'd like to move right ahead to take the keynote address. But before we do that, I'd like to ask kindly that we reduce conversations within the audience to ensure that we can all hear what our speakers are saying. And I'd also like to plead with the speakers to speak a little.
Of Kaduna State, my big sister from before, when we were out in the trenches. Dr. That in solidarity for the ongoing World AIDS Day celebrations, I'm wearing a red hat. But hopefully somebody will help me to tell her in case she missed that. Okay? Honorable commissioners, friends, colleagues, it's good to see you all, permanent secretaries of state ministries of health, executive secretaries, and other chief executives of state primary health care development agencies, directors and leaders from federal and state ministries of health and agencies, including mine, our chief host, the chief executive officer of the Center for Journalism, Innovation and Development, Mr. Dakbolon Yomi, thank you, and other top management of CJID, editors-in-chief, deputy editors-in-chief, and leaders, senior journalists, our partners. I see a few of them, notably I see Vivian from Nigeria Health Watch, and other partners, members of the press, my Auntie Muji, ever present, ever supportive, and of course, the very erudite, I have to call out Mr. Idris Akimbajo, who has challenged all of us and reeled out a lot of numbers. You know, as you were speaking, I was saying, wow, I need to take this gentleman's number so that when I'm going to the National Assembly or to Ministry of Finance or Budget and Planning to go and lobby, I will send him first. He'll go there and cause some trouble. Then when I come, but we really just appreciate the passion and the focus and really look forward to broadening the partnership. I'm very honored to join you this morning at the 2025 CJID National Health Dialogue, which brings together, as we can all see in the room, a very vital coalition towards health progress, a multi-sectoral partnership, our media community, research and evidence, policymakers at the national, at the state level, public health leaders, and other stakeholders. I want to commend CJID for sustaining this platform and for choosing a theme that actually aligns very closely with the agenda of President Bola Ahmed Tinubu's government for the health sector. I think the focus on evidence, on innovation and financing for a healthier Nigeria really embodies the essence of the Nigeria health sector renewal investment initiative. But beyond that, I think the choice of that topical focus also reflects a keen awareness of the reality of the times that we are in. It's one thing for you to align with policies, another thing for you to pay attention and be plugged in to understand all the changes and transitions that are taking place. You know, the structure of global aid financing is changing. The country that we're in, you know, pushing very hard, but going through, you know, what has been quite a substantial fiscal tightening situation, in the context of many reforms, I think I want to applaud CJID leadership and all of the other organizations for the awareness and the wisdom to convene a dialogue to focus on this topical issue. The Health Sector Renewal Health Sector Renewal Investment Initiative provides a framework to deliver health dividends from the government of President Bola Ahmed Tinubu. That is a reform-focused government. As you will all be aware, and I'm sure you all know, lots of reforms going on at the same time and with rapid speed. Of course, they've come with initial pains, but you see, when you're making change, typically it's painful. But I think if we pay attention and we all are going to be honest with ourselves, I think we see the light at the end of the tunnel, because a lot of things that were driving the country down, I think, have now been arrested. Beyond health, there's sort of the health sector reforms, but beyond health as well, when you think about the financial and fiscal reforms that are going on, when you think about the subsidy reforms that have taken place, we know that at least now we've halted a decline and the country is well placed to start to move up. So I do think if you're going to achieve these dividends, I think this place of evidence, the place of innovation, and of course money, I think cannot be emphasized or overemphasized. Evidence ensures that the innovations address the right problems. Innovations bring efficiency and speed and scalability to the interventions and the reforms. And of course, money underlines all of that. Make sure that we're able to pay for it. Ultimately, you have to be able to pay for solutions for in the health system and even beyond that. The Health Sector Renewal Investment Initiative is being implemented through a blueprint that is led by my minister, the Coordinating Minister for Health and Social Welfare, Professor Mohammed Ali Pate. That has 4 pillars. I think every stakeholder in the health sector has heard about these pillars and should know it by now. But I will focus on the first pillar today, which is really around the governance and accountability, as well as financing, for the health sector. What that means is the ability to use evidence to inform what we do, but also to measure as we're doing it in an accountable and transparent way. And that is why, to inform the strategy itself, there was an assessment that was done. And every year, for the second year now, we come together once a year in a joint annual review to say, how are we making progress? What have we advanced on? Where are we running into challenges? Where do we need to pivot our strategy? And a core part of that as well is accountability to our citizens. So which is why the People's Voices survey is a key part of the input into the joint annual reviews. And what we're seeing is that there are still a substantial amount of gaps in equity and access to basic services for Nigerians, as has been highlighted by a number of people that have given keynote addresses. But there is progress, and I think Nigerians are seeing that. And just on that point, I wanted to also just encourage you as our stakeholders, whom we love and appreciate. First of all, just to say that, I believe Vivian and a couple of others did mention that there's some progress now, and there is, and we're very proud of that. But we're also very thankful for the collaboration. I think there are many firsts, that the health sector is enjoying right now. One of them, I think the quality, I've been around a little bit, I wasn't in government, but the quality of interaction and engagement and support from the media, I think we can say that's a first, and you guys deserve a round of applause, if you may, for that. I think the interest, the questioning, and just the honest engagement, I think we have enjoyed it. It keeps us on our toes because we know you're going to ask us questions and we're going to have to answer you. So it keeps us working. But it also encourages us to know that at least, people are interested. So we're not just working in a vacuum and people are not paying attention. And on that, I think it's very important, to highlight the gaps, to highlight the opportunities for improvement. But I think, as you know, as media practitioners, you also have an obligation to drive, I think it was Dr. Ilori that mentioned it, the spirit of hope and ownership among the citizens as well. So when there is some progress, when you see, opportunities, to spread some good news, I think we should, pay some attention to that. One interesting experience I almost always have when I speak and I talk a bit about some of the things that we are doing or have done in collaboration with the states and the local governments under the leadership of my minister. Media practitioners always come and say, you're not talking enough about all the good things. These Nigerians are not hearing all of these good things. And what I usually think to myself, how come they are hearing the bad stuff? I don't talk about the bad stuff. So I ask myself that. How come they are only hearing the bad things? I don't go around spreading news about the gaps and challenges. If I would try to talk more about the positive news. So that is to tell you that there's something we can do together that is better in terms of also being a bit more balanced, because we have a responsibility to also spread hope. We need to do that where there is a real basis, to do that. I think we need to be able to work together on that. On the primary health care level, I think we made a few priorities. Again, just cascaded from the Health Sector Renewal Investment Initiative, where again we use data to say, how do we prioritize? If you have 4 years as a government, at least in the first instance, that's what you work with, and you can't solve all of the problems of decades of neglect and underfunding in 4 short years. So what do? You try to prioritize and say, what are the 2 or 3 or 4 areas that we need to focus on in the period? And so under the leadership of the coordinating minister, we use the data to say, what are the biggest issues that are facing us? Is the issues of maternal mortality and under 5 mortality, and what are some of the biggest drivers of the poor outcomes that have already been talked about today? It's just a lack of equitable access to basic services. When a woman is pregnant and they don't receive the care that they should get during pregnancy, or when they want to deliver and for whatever reasons they are unable to get to a facility within their reach and affordability to receive high quality care, then we're setting the woman up as a system. We're failing them and setting them up as a system, to contribute to these very grim statistics that we have had, which is why the government said that's a top priority. We need to focus on crashing maternal mortality. That's what the president asked us to do, and that's what the minister pushes us to do. Hopefully we men too will find a way to stay alive within that context. But fundamentally, you have to start. If our wives and our babies are alive, I think we will be happy and we will live longer, right? But the primary healthcare system also caters to men. That's just a joke. So we got to work and said, what do we need to do to improve the access to facilities? We've got upwards of 30,000 public health PHCs, and there's a lot of talk about the poor quality. I think that's a fact, But then we looked at it, and even when you looked at the Basic Healthcare Provision Fund ones, even they weren't nearly where they should be. Only about 1/5 of them had the basic complement, which, by the way, we redefined. Again, contextualizing within the reality of our operations, right? So we've moved beyond requiring 24 health workers in a PHC to say, given the health worker migration, given our capacity to produce, given the government's fiscal situation, what is a realistic yet functional minimum that you need? And we redefine that to say, in a primary health center, if you have 6 skilled birth attendants, not 6 staff, but 6 people who are trained, midwives, nurses, doctors, who are able to safely take delivery of a woman that wants to give birth. Then you can have 2 of them for 3 shifts, right? Occasionally, you might have somebody go on leave. But then if they have accommodation, if you have accommodation on site, we have found facilities functioning quite well with even 4. Because then when they don't have a patient, they have a place where they can rest. When they have a patient, the shift arrangement is a bit more flexible in that context. We also defined the minimum amount of equipment and the infrastructure, the wash services, the power, because they need to be able to operate 24 hours. And we got to work and working with our state colleagues. And again, just like we have enjoyed partnership with the press, I think we've also enjoyed good partnership with the state government and, in fact, the local governments, who everybody now agrees and everybody is invested in making sure the primary healthcare system works. And I think over the last 2 years or year and a half since this started, we've done about 2,100 plus additional facilities completed, many of them now staffed. The states are now recruiting. Kaduna State was actually at the forefront of that. I think between about 5 or 6 states, 13,400 community-based health workers and over 1,200 skilled birth attendants have been recruited. And Kaduna, I think I must say that, actually was at the forefront of that through taking on some incentives that the federal government is providing for states to be able to hire. Because you can build or refurbish the facilities and equip them. If there's nobody to work there, it doesn't really serve the women. So that's the critical bottleneck. We've embarked on an aggressive and ambitious